questions using the question forum here on Microsoft Teams. We'd also like to welcome those tuning in this afternoon on Rogers Television, Rogers Facebook page and YouTube channel, those listening on Global News Radio, AM 980, and those watching on the CTV London website. We'll get to the opening statements right away, and we'll start with London Mayor Ed Holder. Mayor Holder.
Well, thank you, Beth, and good afternoon, everyone. I'd like to start first with the check-in from our head of bylaw enforcement. I'm happy to report that while numerous premises were inspected over the weekend, all were compliant and no charges were issued. I say well done, London. And I think that's representative of how we've been seeing our community for several weeks now. We continue to see a downward trend in our daily case counts, and it seems very likely that as a result, we'll have earned the right to enter a less restrictive tier by this time next week. Those announcements are made by the Ontario government on Fridays, and in this case would take effect if done on Monday, March 1. So to be clear, we won't know until then whether we're being moved out of red. But you know what's important over the next few days, and especially over the next several months, is to stay the course. If our restrictions change, our commitment to public health guidelines must not. Think of the people even in Lambton County, very close by. When London came out of lockdown last Tuesday in the red tier, they were in the orange tier. And a week later, they've been moved to red as case counts continue to rise. And that's why I'm saying this can all change so quickly. And if we're so fortunate as to open more of our economy, we want it to be sustainable and for the long term. We don't want a reprieve of 1 week or 2 weeks, only to tighten things up all over again because we lose focus. So as I've said all along, that while the Ontario government controls what color we're placed into, it's we who control our own behaviors. And that's really what I hope we continue doing, regardless of what is announced on Friday. So those are my thoughts, and please, over to you, Dr. Mackie.
Thank you very much, Mr. Mayor. Completely supportive of your comments. We are in the red. We're on track to move to a lower level of restriction, hopefully by Monday. Whether that's orange or the yellow level restrictions will be a decision of cabinet. We're certainly supportive in looking at the numbers right now that, according to the provincial framework, would likely put us in the yellow. Of course, things can change over the next couple of days, and we know that the variants of concern are on the horizon. They really are the one X factor right now. But it's clear based on the local data, we're at a level of disease activity that is quite a lull compared to what we've had. No days over the last week and a bit where our case counts were over 20, and we actually have not had fatality in our community since February 12th, which was reported on the 13th. So now over a week with no fatalities, which is very reassuring as well. Big part of that is because of the vaccine campaign, and we're really moving well through the long-term care and retirement homes right now in the vaccine campaign. Also seeing the expansion out to the Mount Bridges clinic site, which serves both the County of Middlesex and the City of London right now, in addition to the Agriplex site. We're on par over the weekend, roughly still with about 1,000 vaccinations per day. Still working to get access to the provincial reporting system so that we can track those numbers a bit more precisely. But things are moving well in the clinics and in the border deployments. We're also continuing to receive reassuring advice about the number of vaccines that our community will receive over the next while, with current forecasts indicating increased vaccine supply in March and then increased again in April. And so working feverishly to make sure that additional vaccinating capacity is available when those larger doses come into our community. Beth, I will pause there, and I know Dr. Dukelow has a few things to say.
Thank you very much, Beth, Mayor Holder, and Dr. Mackie. Appreciate the opportunity to join you today and provide a brief update on the COVID-19 situation at LHSC. I'm pleased to report we have had no active outbreaks in our hospital for 17 days. So we're entering our third week with no active outbreaks, which is great news for our patients and our community. We're also seeing a continuing decline of inpatients that are COVID-19 positive. Today, we're caring for 13 inpatients with less than 5 in our ICUs. While the current COVID numbers are declining, we are carefully monitoring the local, regional, provincial case numbers, as well as the variant of concern prevalence, as Dr. Mackie mentioned, to ensure we're ready to respond to any potential increase in cases in the coming weeks and months. In addition to our ongoing COVID response, we continue to focus on maintaining as high as possible volumes in surgical activity and working with our health unit partners in the vaccination campaign, as Dr. Mackie mentioned. We will continue to partner with our health unit colleagues to identify the next hospital team members that are eligible for their first dose of the vaccine as the regional vaccine supply ramps up. And it's very welcome news to hear you say, Chris, that we expect increasing supply in March and then again in April. Thank you to all those who attended today and for listening in, and I look forward to your questions. Over to you, Beth.
Thanks very much, Dr. Dukelow, Dr. Mackie, and Mayor Holder for those opening statements. Again, I would encourage any of the media who are in attendance this afternoon to please do submit your questions if you have them in the question and answer forum. That's if you hover above the right-hand toolbar there, submit your questions as they come in this afternoon. We'll get to some questions right away. We have a number from Jennifer Beeman from the London Free Press. Off the top, they are for you, Dr. Mackie, so we'll start with the first one here. Dr. Mackie, from Jennifer Beeman at the London Free Press. Are there any additional variant cases in London and Middlesex? And has the variant been involved in the 2 most recent cases that have been identified?
Yeah, so the answer is a quick no and no. We're still a total of 6 variant cases. The last 2 that were identified last week have not been sequenced yet, so we don't know exactly which variants. The first 4 were the UK variant. Hopefully no more of those anytime soon. But as you know, all the positives are now tested across the province to identify whether they are variants of concern. Nothing in the last 100 or so cases, aside from the 2 that we mentioned that were travel related.
Great, thanks very much, Dr. Mackie. We've got 2 more questions here for you from Jennifer Beeman. And Jennifer, if it's all right with you, I'm just going to combine them since they're both about vaccine. Dr. Mackie, when will the health unit be opening the 2 additional vaccination sites in London? And how many weeks of vaccine shipments are confirmed?
Right now, we're planning on opening at least one of the 2 additional London sites in the month of March. We will confirm that as soon as we can. Really depends on the clarity of the vaccine shipments. Right now, we have capacity that's adequate to move the large doses that we are receiving. And, we'll be ready to open those clinics as soon as they're needed. But we don't anticipate having enough vaccine to justify a 3rd mass clinic until sometime in March, to be determined exactly when.
Thanks very much, Dr. Mackie. And how many weeks of vaccine shipments are confirmed?
Right, thanks. So we have been getting about 2 to 3 weeks, depending on the week that we receive the projections. We have, tentative projections out, as I'm saying, right through to the, ballpark projections, I should say, to the end of April that show increasing availability. So, those are the data points we're working with, and that's why we're increasing the capacity, but we don't have confirmed shipments. And even when we have, specific numbers over the next 2 or 3 weeks, they always have to be confirmed the same week. And because there is still, uncertainty around availability and how the manufacturing scale up is going at the European facility. So, while we may get, we may get actual numbers for the next 2 or 3 weeks, and then projections for the next 2 or 3 months. They still have to be confirmed the week that we make that we receive the shipment.
Thank you, Dr. Mackie, for your response on that follow-up question as well. Dr. Dukelow, we have a question here for you from Jennifer Beeman with the London Free Press. How many vaccine doses are being given out at the Agriplex each day?
Thanks very much, Jen, as well as Beth. So my current understanding is between 700 and 1,000 at the Agriplex per day, with the balance of those vaccines more vaccines being administered, as Dr. Mackie mentioned, in within retirement homes, as well as now at the Mount Bridges Clinic. So it's the health unit really is doing a great job to ensure as many vaccine doses can be delivered as can be delivered are, and we're still limited by our supply chain. The Agriplex does have the capacity to go up to 1,300 doses per day, but we don't have the vaccine to do that at this point in time.
Thanks very much, Dr. Dukelow. And another one here for you from Jennifer Beeman at the London Free Press. Dr. Dukelow, do you think the virtual urgent care pilot Children's Hospital is participating in should become a permanent program post-pandemic?
That's another great question, Jen. So we've had lots of very positive reviews to date about the virtual urgent clinic that has been run by our Children's Hospital over the past number of months, and then it expanded, as you know, based on the press release this week. And we're one of a few programs in the province that is providing this type of virtual urgent care or urgent emergent care for children. And we look forward to participating in ongoing work to continue what makes sense for our patients and the system post-COVID. So I think there will be some form of this type of clinic going forward, and would support that, especially given the positive reviews that we've had so far, but we have to work with the ministry to figure out exactly what that looks like.
Great, thanks very much, Dr. Dukelow, for that response. That actually leaves us with no questions in queue. So thank you, Jennifer, for your questions this afternoon. And thank you, Dr. Dukelow, Dr. Mackie, and Mayor Holder for joining us this afternoon. We will be back on Thursday at 2 o'clock, so we will see you then. Have a great afternoon.